We don't know how long we're going to be virtual for because they say it's a week, but they said that in March 2020. They said, oh, it's a 2-week break. 2 years later, look where we are.
I'm Addison Smith with Campus Reform. Colleges across the country are shutting back down due to the Omicron variant. But it raises an important question. What impact is this having on students' mental health? A Brown University professor recently wrote an article arguing that schools need to open back up for students' health because suicide and depression are actually more harmful to students than coronavirus. Where do you stand with the school lockdowns? Do you think they should be closing or do you want them to stay open?
No, I definitely think with the vaccine requirement and the booster requirement and the mask mandate that they should definitely be staying open.
I think it's okay to open back up if things do start to calm back down.
I also think they should open back up because we're getting our master's right now with speech pathology, so we need to get more hands-on experience.
I hate remote learning because I cannot talk directly to a teacher, and if I email them and they'll respond you longer than 24 hours for emailing.
I think they should stay open. I just don't think online school at this point is really worth our time. It's not the same experience and we're gonna have to pay the same amount, so.
We don't know how long we're going to be virtual for because they say it's a week, but they said that in March 2020. They said, oh, it's a 2-week break. 2 years later, look where we are.
I think it was definitely a good try for them to try to come back in person, but it's definitely a bad idea.
I think it feels a little bit irresponsible to keep staying fully open, especially given that the only requirement is the booster.
Do you think that there's any negative impact that these school shutdowns can have on students?
Absolutely. It's just very hard to learn when you're just laying in your room trying to do online classes. There's no engagement, just staring at a computer screen. At this point with the vaccines and the boosters, there's really no reason that we shouldn't be in person.
Probably from a more mental health aspect, just being stuck at home, stuck in your dorms, not being able to see other people. I think that would definitely negatives.
Definitely. I think there's, of course, the impact that everyone's felt with just being locked inside. But there's also an issue with the actual quality of the education.
I don't think you're as engaged with the material or the class as much.
We're getting the lesser version of our learning and it's not as beneficial.
There's some people who can't learn unless they're in the classroom environment.
Zoom learning is not nearly as effective as being in person.
Yeah, I think so. On your education and getting the hands-on experience. And also, socially, it's nice to, be able to be around other people and learn with other people.
Mostly social for me. That's where I met all my friends in undergrad.
It definitely also affects mental health, especially for people who have a problem with depression and isolation. And
there was a study that came out in November that showed over 48% of students reported increased levels of depression during the pandemic. In 2019, about 12% had contemplated suicide. That number rose in 2020 to 25%. Do you think the lockdowns could be playing into that?
Absolutely, yes.
Oh, well, definitely.
Definitely.
If you're not around other kids your age, you're gonna get lonely.
Especially at this age and just humans in general, you're meant to engage with people. You're not meant to stay locked in your room.
You get people, they've got nothing better to do than to sit down, watch TV, watch YouTube, play video games. It's very easy to get into a shell.
Something that aids depression is your environment. Say you have a bad family situation and you're stuck at home with your parents who are
constantly fighting, and that's obviously going to decrease your happiness. Being stuck inside, you need sunlight. Seasonal depression, but quarantinal depression, or whatever the term would be.
Human interaction is definitely, I think it contributes to that.
There was a Brown University professor who wrote an article essentially arguing that schools are shutting down, they say, for students' health, but when you look at the data of depression, suicide, she was actually using that data as an argument to open back up. About 1,700 college-age students have died from COVID, which is 6 times lower than the college-age students who are committing suicide. What do you think about that?
Didn't know that. That's actually crazy.
Definitely why I think full lockdown is probably not the best way to go.
Yeah, so you think that may be an argument for opening up?
Oh yeah, definitely.
Yeah. Students who feel comfortable coming to school should definitely have the option.
Yeah, I guess I agree with that statement.
Yeah, I definitely could see how that could be happening.
I think it's a double-edged sword because if you care about students' health, it's also our physical health is just as important as our mental health. I don't think we should just open up because people will be happier. You can't be happy when you're dead.
I think that is a good point. It just has to outweigh the pros and cons of both the pandemic with student mental health, student health in general.
Personally, I still feel they should stay shut.
I don't think it's worth it opening back schools.
I understand why they're being cautious, but there's also side effects that they maybe haven't been thinking about as much.